We're following up on the concerns from hospital and county health leaders over a backlog of patients leading to overcrowding in emergency departments, among other issues.
That's right. They're mainly blaming a lack of room in nursing homes, which means more elderly patients are taking up room and beds in the EDs. But one expert today told us Medicaid reimbursements are also gumming up the works here. Isabel Garcia joins us in studio with the latest on this. Isabel.
Yes, good evening to both of you. Hospital leaders say at Strong alone, there is an average right now of about 100 patients currently just waiting to be placed in a nursing home. And of the 886 beds, they've been over capacity already for the last month. Now, local attorney Kelly Guzmano explains how this scenario is causing confusion when it comes to Medicaid and billing. Area hospitals and emergency departments already dealing with overcrowding and overcapacity even prior to the winter months. Along with a lack of nursing home bed availability, Medicaid reimbursement rates not covering the full cost of care, cited by hospital leaders as one of the contributing factors.
We have in the hospitals lately, not because they need the care, but because they can't go home, they can't be cared for at home. And what happens is if you're in a hospital and you're no longer receiving skilled care, you have no medical need to be there, the hospital can't bill your insurance.
Local elder care law attorney Kelly Guzmano explains Medicaid budgets based on a patient's status. For example, whether they are admitted to the hospital, going home, or being sent to a nursing home.
So we're having clients where they're having these prolonged stays. We get them on Medicaid, but they still have to pay a lot towards their hospital bill. So it's causing backlogs, it's causing confusion, it's causing billing issues.
Those rates, she goes on to say, are typically negotiated with the state and often revised. For example, a patient pays $1,000 a month. Medicaid will cover up to a certain amount set by that reimbursement rate. Now, private rates for nursing homes in our area range between $14,000 to $18,000.
Unfortunately, it is substantially less than what they get privately, and I think a lot of nursing homes are feeling the strain that it's putting on their system because they're not getting enough pay, they feel, to adequately provide for care, for staffing.
And to address the nursing home bed shortage, hospital leaders say they are working with the State Department of Aging to create a task force made up of local individuals. We have reached out to that office for more details about that. For now, though, we'll send it back to you at the desk.
Isabel, thanks. We're also learning a bit more about the multi-million-dollar grant the hospitals mentioned yesterday. They say the money would also go towards helping train more nurses and more. That'll come from the American Rescue Plan funds and still needs to be approved by the legislature next month.